Hello, we're Sylvie, Paola, and Atiya, and today we will be discussing Lyme disease. Here's what we'll be talking about. First, we'll give a brief background on Lyme, including a definition, an overview of symptoms, and diagnosis. Then, we'll illustrate Lyme disease on a global scale and narrow our scope to the Canadian context. Finally, we'll end off with steps that you can take to prevent Lyme, as well as future prospects for the disease.
Lyme disease is the most common vector-borne disease in Canada, United States, and Europe. Vector-borne means that the agent that causes the disease is transmitted by a vector, usually insects. In this case, the vector is a tick called Ixodes scapularis, more commonly known as black-legged tick. The agent is an spirochetal bacteria of the Borrelia species. The most common one in North America is Borrelia burgdorferi. In the epidemiological triangle of Lyme disease, Borrelia bacteria is the agent. The hosts are most commonly humans, rodents, and deer. And lastly, the most prone environment for Lyme are heavily forested areas in the North Hemisphere with a temperate climate. Lyme disease is more easily transmitted by a nymph form of ticks rather than adult tick. This is because nymph forms are smaller in size, thus more difficult to be perceived by humans. Also, adult ticks are less likely to bite humans. The nymph forms are more active in the spring and early summer, as we can see in green in this diagram. And in fact, humans are more likely to show signs of Lyme disease in June to August. And adult ticks are more active in the fall, when fewer cases of Lyme disease are seen. The most typical symptoms of Lyme disease is a skin rash called erythema migrans that appears at the site of the bite a few days to weeks after the contact with the tick. This rash affects about 80% of the patients. Other common symptoms are joint and muscular pain that can last for months or even years. This can affect nearly 60% of the patients. However, if treatment is given, this number drops down to 10%. Several steps should be taken into account when diagnosing Lyme disease. History taken is crucial to determine whether the patient was in an endemic area, if there was a tick bite, and what the symptoms were. There is also a serological test that identifies the presence of antibodies against the Borrelia species in the blood. A positive test means that the person had contact with the bacteria.
Now we will talk about the prevalence of Lyme disease across the world. Prevalence is the number of existing disease cases in a population, also known as the burden of disease. It considers the whole population rather than a subset of individuals who are at risk. An effective method to determining disease prevalence is using serology tests. In 2021, the Dawn Group conducted such a study to determine the global prevalence of Lyme disease. They gathered information on the proportion of various populations around the world that had tested positive for Borrelia antibodies. They did this using surveillance reports and clinical trials that had used standardized laboratory tests to determine positivity. They then pooled the data, including 89 studies, in their report. Resultantly, the group found that the global seropositivity for Borrelia was 14.5%. This means that an estimated 14.5% of the world's population has previously been or are currently infected with Borrelia, and therefore previously had or are currently have Lyme disease. The group also showed that Lyme disease is the most prevalent in the northern hemisphere of the world, with the largest number of cases seen in Central Europe, Western Europe, North America, and East Asia. Central Europe had a seropositivity of 20.7%, 15.9% in Eastern Asia, 13.5% in Western Europe, and 9.4% in North America. Over the past couple of decades, the global prevalence of Lyme disease has also been on the rise. This is likely due to factors such as temperature changes that result from climate change. As seen in this graph from the World Health Organization, the number of Lyme disease cases in Europe have been on a steady rise since 1990. In comparison to prevalence, incidence measures the occurrence of new disease cases in the population among at-risk individuals. The incidence of Lyme disease is also regionally influenced, with the highest rates seen in countries in Central Europe, such as Hungary with an incidence of greater than 16 cases per 100,000 people and greater than 130 cases per 100,000 people in Slovenia. In comparison, Japan has a low incidence of only 0.008 per 100,000 people. These disparities are due to Lyme disease's temporal distribution and the dependence of ticks on specific climates to survive and reproduce. Global incidence of Lyme disease has also been steadily increasing in the last 4 decades due to climate change. Now, who is most at risk for Lyme disease? The Dawn group found that seroprevalence was highest in people over the age of 80, men, and those residing in rural areas. This is most likely due to environmental factors. Typically, males of older age, especially those living in rural areas, engage in more outdoor activities that involve exposure to tall grasses and forestry that hosts ticks.
Within Canada, Lyme disease became nationally notifiable in 2009, meaning our official national measures of Lyme only extend that far back. Provincial and territorial health agencies report both probable and confirmed cases of Lyme to the Public Health Agency of Canada. Information collected includes age, sex, and geographic location. Even though reporting is mandatory, we still experience underreporting and misdiagnosis, which results in an underestimation of Lyme disease. A study examining underdetection in Canada indicated that for every person with a reported case of Lyme, there are approximately 30 other people with Lyme not captured. So between 2009 and 2021, provincial public health units reported 14,616 human cases of Lyme across Canada. In this table, you can see how many new cases of Lyme were reported every year, and data from 2021 is preliminary as it had yet to be finalized. And the question we should ask ourselves when looking at this table is, why do we see such a significant jump in the number of cases of Lyme after 2016? Well, this jump exists because the case definition of Lyme was revised in this year. This was done so as to enable provinces and territories to report both probable and confirmed cases of Lyme. As a result, more cases were able to be reported. We can also look at the overall incidence of Lyme on a yearly basis in Canada. As per the preliminary data from 2021, the national incidence lay at 7.5. This incidence varies across the country and on the basis of certain factors, such as age and sex. Generally, there has been an upward trend of reported Lyme disease since 2009, and it is estimated that this number will continue to increase. Overall, the annual number of reported cases was nearly 20 times greater in 2021 relative to 2009, with the incidence increasing from 4 to 7.5. Delving more into the specifics of where Canadians are getting Lyme disease is most common in Ontario, Nova Scotia, and Quebec. In 2019, 95% of reported cases occurred in these 3 provinces. And overall, this distribution makes sense. The circled, shaded areas on this figure here depict the Lyme risk areas across Canada. These are locations where infected black-legged ticks are established and where people have the potential to come into contact with them, and as a result, get Lyme. And we see this further reflected on this map of Canada, which shows in the bubbles how many new cases of Lyme were reported in each province in 2019. The darker colored areas denote higher incidence of Lyme disease, which coincide with the risk areas we previously showed. The province with the highest incidence in 2019 was Nova Scotia, with 85.6, which was 12-fold greater than the national incidence of 7. Interestingly, from 2009 to 2019, no cases were reported in the Yukon, Northwest Territories, and Nunavut, largely because of the types of ticks found there and short summer seasons. So which Canadians are getting Lyme? Well, risk of Lyme is not only influenced by where you are, but also who you are in Canada. All Canadians are at risk of Lyme disease if they come into contact with an infected tick. However, certain groups within the population experience Lyme more than others. From 2009 to 2019, it was observed that children aged 5 to 9 years and adults aged 65 to 69 had the highest incidence rates of Lyme. The cumulative incidence was 45 and 74.3 respectively. Furthermore, for all age groups but those under 4 years of age, incidence of Lyme disease was observed to be higher in males, as they made up 57.3% of all Lyme cases. We see this reflected in this bar graph here, where the blue bars denote males and red-lined females. Other risk factors predispose Canadians to Lyme. For example, Lyme disease is more common in central and eastern Canada, as well as amongst those working in parks, forestry, and agriculture, and participating in activities such as hiking and gardening. Finally, some Canadians get Lyme when they travel to other endemic areas across the world, primarily in Europe and the United States. And finally, when are Canadians getting Lyme disease? In general, as previously mentioned, ticks are most active in spring and summer, and we see this reflected in how many cases of Lyme occur at specific times of year in Canada. Drawing on data from 2009 to 2019, we see that more than 95% of cases occurred from May through November, and more than 75% of these cases had symptom onset during the summer months of June, July, and August. Notably, 35% of cases occurred during the peak of the summer in July.
Now, we are going to talk about how to prevent Lyme disease using measures of association to identify risk factors and preventive factors. Odds ratio and risk ratio are measures of association used to determine whether an exposure such as a tick leads to or prevents an outcome such as a Lyme disease. The risk ratio assesses the risk, while odds ratio assesses the probability. If they are equal to 1, it means that there is no relation between exposure and outcome. But if the result is less than 1, it shows that the risk or probability of the disease is lower in the exposed group. So, being exposed to something is a preventive factor. However, if it is more than 1, it means that the risk or probability is higher in the exposed group. So, exposure is actually a risk factor. We are now going to see some examples of preventive and risk factors associated with Lyme disease. A study found an odds ratio of 0.4 when comparing a group of people who had a bath after spending time in the yard versus those who did not take a bath, showing the bathing was a preventive factor as it decreases in 60% the probability of getting Lyme. Wearing protective clothes such as long sleeves and long pants is also a preventive factor, as the odds ratio was 0.6, meaning that it decreases the odds of having Lyme by 40%. Using tick repellent also reduces the odds of getting Lyme by 20%, with an odds ratio of 0.8. When talking about preventive factors, the further the odds ratio is from 1, the more efficient the preventive action would be. For instance, taking a bath was a stronger preventive factor than wearing protective clothes. And this one was a stronger preventive factor than the use of repellent. The duration of the tick attachment to the skin is an important risk factor. And a study showed that the odds of having Lyme disease after 72 hours of tick attachment was 23 times higher. The first step on the management of tick bites is in fact to remove the tick as soon as possible. If someone got bitten by a black-legged tick in an endemic area for Lyme and the tick remained attached for at least 36 hours, there is an antibiotic called doxycycline that can be used as a preventive if it's given within 72 hours of the tick removal. This would reduce the risk of getting Lyme by 3. Now, we will move into the future prospects of Lyme disease.
Now, why is climate change impacting prevalence and incidence of Lyme disease to such an extent? This is because I. scapularis spends more than 98% of its life cycle outside of its animal host and is therefore heavily dependent on environmental temperatures to survive and reproduce. By 2080, I. scapularis ticks are predicted to migrate as far as northern Ontario. As temperatures rise, previously uninhabitable areas become suitable for tick survival and reproduction, causing these ticks to migrate to higher altitudes and exposing new populations to the disease, leading to increases in Lyme prevalence and incidence. In addition to migrating to higher altitudes, the warmer temperatures lead to longer summer seasons and warmer winter months, allowing for increased tick activity and more potential cases of Lyme. On the bright side, however, is that vaccines have the potential to limit the significant increases in incidence of Lyme disease seen with climate change. In the early 2000s, a vaccine called Limerick's was developed to protect against Lyme, and despite an efficacy of 76%, it was removed from the market due to public concerns over its side effects. Due to this rising public fear, developmental efforts for a Lyme vaccine were halted. But with the rising incidence influenced by climate change, interest in developing a vaccine has once again increased. In 2014, the Resnick Group developed a vaccine that was shown to be highly effective in producing an immune response in those who were previously infected with Borrelia. Should this vaccine become available for public administration, it has the potential to reduce the incidence and prevalence of Lyme disease around the world.